blood cells, CBC is totally normal.
So we're pretty certain that this is not an overdose.
Wait, look. His LFTs are elevated.
Just barely. So what's that tell us about his neurosymptoms? It's not like he's in liver failure.
Right, but what can cause elevated LFTs and seizures?
Alcohol.
Right.
So I'm going through Paul Gunderson's blood work, and everything looks pretty much normal. He does have elevated liver enzymes, which could represent alcoholism and delirium tremens.
If he's been on the wagon and not drinking for the last 2 or 3 days, he could be going into DTs.
That would explain the seizures, the sweating, and the tremors.
And those crazy blood pressures.
And there is a correlation between OCD and alcoholism. Maybe he just went cold turkey.
Now we're just inventing his history.
His history was a question mark, and we needed to find out where he was and what he had been doing and what his habits were and what could have caused this.
Lopez, you find anything interesting in Mr. Gunderson's stomach?
His last meal was salad.
Great. Where does that leave us?
Got me, man.
His temperature's 101.2.
It's another one for West Nile. We should have never dropped it so low in the differential. I mean, it was this cheap complaint.
Come on, man. That's like somebody coming in here with gastric pain insisting they have a tapeworm.
Yeah, well, sometimes they do.
This guy was deteriorating fast. I'm kind of irritated with myself, and there was just no more room for guesswork.
I want to admit it, and I want to get an LP. Lorraine, can you make that happen?
Absolutely.
Hi there, little one. Hi.
So I got nothing from the parents. According to them, she's a normal, healthy, active 2-year-old.
I'm just sitting in the room thinking through what could possibly cause these sorts of symptoms in a little girl. It's the most unusual case I've ever seen.
Do you remember her brother saying that Sandra complained of a tummy ache before coming to the hospital? I made a note of it.
Sure. She ingested marijuana.
But she didn't ingest marijuana and she still has abdominal pain.
Tox screened and negative, wasn't it? Bowel sounds are hypoactive too. Why don't we get a portable ultrasound, see if we can figure out what's going on in there.
Okay.
Fluid's clear.
Doesn't necessarily mean it's negative.
So you do think this can be an infection?
No, I'm just saying.
Excuse me. I got a call. Someone told me my father was in critical condition. What's going on?
So Paul Gunderson's daughter, Tori, comes in, and we are all hoping that she could shed some light on the situation.
He doesn't have West Nile, does he? That's all he's been talking about for 2 weeks. He's obsessed with mosquitoes.
Can you just take it easy on that right now?
That's the way he
We'll be done with this in a
likes it.
second. You can
Sorry.
fix his socks.
I'm sorry.
We got a needle in his spine, that's all.
Sure.
She started straightening out his socks while I was doing a lumbar puncture on him, while I was in the middle of a spinal tap.
We done in 2 seconds, okay? Lars, put a rush on this, okay? I need something a little more definitive from the lab than cloudy or clear.
Liver and gallbladder look clear.
Looks like the appendix is all right too.
Oh my God, stay in that spot.
That's fluid. That's free fluid. Let's get an abdominal CT scan stat.
Fluid in the abdomen is a bad thing. There's different kinds of fluids that can show up in there, and if they do, they almost always mean that there's some kind of a problem.
Let's try to figure out what's leaking in this little girl.
Okay.
This program dramatizes true medical mysteries told by the real doctors who solved them. Names and characteristics of patients and other individuals have been changed.
Okay, here's the deal. He says they're in his little vegetable garden thing. I told him if he's so concerned, he should stay inside and shut his windows.
So Paul Gunderson's daughter, Tori, comes in, really sweet, really nice. Some of her little quirks and stuff were like cute. But at the same time, when you have a dying patient, you find them less cute and more just irritating.
I mean, he's so paranoid about getting bitten, he's taken to wearing turtlenecks, even in this heat.
Look, is there anything else you could tell us about him?
Clearly, he has OCD. He works from home. He spends most of his free time either in his little vegetable garden or cleaning his place. And no real health problems. I mean, physically.
Does he drink?
Alcohol? Never.
Boy, we got a Code Brown in here.
What's Code Brown?
You paged?
Yeah, we have a new symptom.
Specifically?
Diarrhea.
Hi, I'm Tori Gunderson.
Could it be food poisoning?
Rotavirus or salmonella can both present with GI symptoms and headache.
I'm sorry for interrupting, but isn't salmonella from undercooking food? Well, my father is on a raw foods kick right now. He read something in the paper that made him paranoid. Pretty much all he eats is vegetables.
Besides that, we'd be ignoring the seizure activity which comes with that kind of food poisoning.
Maybe it's an electrolyte disturbance, malnutrition.
No, all those symptoms point to cholinergic syndrome.
Cholinergic syndrome is basically a conglomerate of symptoms that results in something we call sludge. We call it sludge because everything just leaks, okay? Your eyes tear, you sweat, okay? You become diaphoretic, you get diarrhea, and this guy had it bad.
His whole autonomic nervous system is in revolt.
Wait, let's go back to the food poisoning thing for a second. I mean, there is one food, one vegetable, that could explain all of his symptoms.
What?
Mushrooms.
All right, about 10 more slices.
So we rushed her off to a CT scan, and it's a pretty accurate scan that actually takes images and slices of the middle of somebody's abdomen as if you're looking at their feet. And in that, we were able to identify fluid in her abdomen.
Right there, stop. See, that does look like fluid in the retroperitoneum there.
From what?
Holy.
Oh, sorry, where's Anthony?
In there, in CT.
I just don't know what it is.
Baby girl's hematocrit from the latest CBC is down 4 points in less than an hour.
All right, that fluid we're seeing is blood.
Oh my God, she's bleeding to death.
Call Brutolin, you need an OR.
I got it. I need an OR stat.
I think she has internal abdominal bleeding.
What?
I know that the patient is bleeding internally, and I know that she needs surgery right away to figure out where the bleeding is coming from and to repair it. But before I can do that, I need to break the news to the parents and get their permission to actually do the surgery.
You're not slicing my daughter open just to go explore.
Sir, I understand your
Maybe I didn't make myself clear. You are not scoring my daughter for life unless you have a very good reason.
Listen, your daughter could die if we don't do this procedure.
Please, please let them do it, honey.
Please, Mr. Ruiz.
Alex, did you finish analyzing Paul Gunderson's stomach contents?
So I go to the lab to follow up on my theory that potentially this patient had a mushroom poisoning.
Any sign of mushrooms?
Not that I could see, but these things are hard to analyze.
Given the fact that he was a vegetarian and obsessed with this garden, apparently, I thought that it was a significant possibility.
But I did run his serum titers and they were negative for West Nile. Also, his LP was negative for any signs of infection.
Yeah, that's helpful. You know what? I'm sorry. That actually was pretty helpful. Yeah. Oh, man, you gotta be kidding me.
Scalpel?
Scalpel.
Ankeny, you're on retractors. Cutting.
Incision time, 4:22 a.m.
Here we go.
Clamp.
Another one. Thank you.